accomplished people here. And I also want to thank the SAP administration for having this set up and coordinating with us. Thank you again. So in this talk, we will talk about how technology will help with fall prevention and overall aging in place. So my name is Swathi Balantrapu. I'm a physical therapist by profession. And really my passion started when I was like, 19, 18 years old. And my own grandma fell down as she was walking down the stairs. And she was admitted in a hospital for almost like 4 weeks. And then back then, there was not so much of advancement in medicine. So she was not operated because of her age. She was 78 years old. And they said, well, she has to be in the hospital for a month. And then she was then transferred over to a nursing home. And being in a nursing home for another 3 months, she was just declining in health. And I just remember still, like, she was asking me she wanted to come back home, soon. And that did not happen. And after 1 year, she actually passed away. She could never walk again. So that actually struck me when I was that young. I was thinking I should do something. I didn't know what it was going to be, but then I thought, okay, I should do something for older adults. And then came my bachelor's in physical therapy, which I'm going to talk about in the next slide. So a little background about my education. So I went to undergrad PT school, physical therapy school in India, and then I moved to United States in 2010. And I finished my master's in kinesiology at University of Illinois Urbana-Champaign, and also did my doctorate in physical therapy later on. I was awarded the Carol Chittenden Fellowship for the entire master's degree, which is a full scholarship. It was one of the prestigious awards that I won. And during my work, I did a lot of research in multiple sclerosis, physical activity, and how exercise helps neurological population like MS and spinal cord injury. So I published over 20 journal papers and cited widely in over 1,500 papers. And I also have filed 2 patents recently for one of the products that I'm going to discuss today, AgeWiser. Professionally, I'm a board-certified geriatric clinical specialist, and I'm also a certified exercise specialist for aging adults. Recently, I have been awarded, American Physical Therapy Association has awarded me a Clinical Excellence Award for the year 2024. Currently, I work as a researcher at Stanford School of Medicine and also affiliated with Veteran Affairs. So right now we are running a randomized control trial, and I'm responsible for designing exercise interventions for folks that are on kidney transplant list and also who are on dialysis. Apart from that, I own an independent PT practice, and I have been seeing patients since 2016 with my independent practice. And I've seen over 10,000 visits, which translates to about 3,000 patients, roughly. And predominantly, my population is between 60 and 80 years old, and 30% of them over 80 years. So moving on to our next slide. So that's a little bit about me. And I'm a mom of 2 boys here. They're 7 and 9. That's Satvik and Ritvik, 9 years old, Satvik, and Ritvik is 7 years old. They keep me very busy, as you know. And I'll tell you an example here, because we're talking about falls. I'm very lucky, just to be healthy and happy here, because they always have these wheelie cars on the floors left without any warning. And just stepping on them, I feel like I'm lucky if I just have a sprain or just a bruise and not a fracture or falling over. So anyway, moving on to the next slide. So if you're wondering who this person is in this slide, she's my 91-year-old physical therapy client that I've been seeing her for the last 2 years. And you may be wondering, why I have her in this slide. So the story behind this is she's 91, but cognitively, mentally, and physically, she is at a level of 60-year-old. And I always wondered, like, why some of us age so gracefully and some others not so much, right? And when I asked her this question, what is that, that you do that is different? What is your secret for longevity? And she goes, I have lots of friends. And she's still connected with some of the friends that she has in college, which kind of amazes me, like how, she's so well connected. She goes out for lunches, dinners, and she's very busy with her friends throughout the day. And when I say I need an appointment with you for next week, and she goes, well, I have lunch with this person on Saturday, I have lunch with this person on Thursday, so I cannot get her appointment. And that's one of the reasons I think, she says longevity and quality of life depends on social connectedness. And the two other reasons that she mentions to me about her quality of life is she lives her moment and she's very happy. And this is not just with one person, but as you may recall, in my previous lives, I have had multiple patients that actually said the same thing. Because I asked, if somebody is like over 75, 85, I ask them, like, what do you do? What is your secret for longevity? What do you eat? How do you exercise? How do you keep yourself engaged? And these are the questions that I always ask, and they say, this is a common theme, along with exercise and good nutrition, of course. Okay, now having said that, don't tell me that you're going to walk out of this room because you want to be happy. So, going on to the agenda, so I'm going to talk about the geriatric, state, like what is the current state of geriatrics, what problems do we have, and what are some of the fall risks that are associated, with older adults, and why people fall down, and some of the solutions that we have, and outcome measures that we use to predict falls, and what the 4 pillars of care for caring our older adults in a comprehensive way. And lastly, I'll discuss about the AgeWiser.ai, which is the product that we developed in the last 1 year. So really, falls and how it's what the impact of falls is. So I'll just go over this landscape, and this is a lot of statistics that I'm going to go over, but let me give you the definition of a fall. So fall is something that's unintentional lowering of the body to a different surface, be it a couch, a chair, or even something just lower, right? A car seat, or sometimes it's like all the way to the ground. Of course, that's a fall. And 1 in 4 Americans actually fall over, and less than half of them actually report that they fell down. So that's actually very sad. And every 11 seconds, a senior suffers a fatal fall in United States. And if you see the triangles in that second image, the blue and the red, the blue is indicating the number of people, the population in 2018. So we had like about 52 million people in 2018. And they reported about 36 million falls and 8 million injuries. And out of the 8 million injuries, which are both fatal and non-fatal, we have had in 2018 about 300,000 hip fractures, and hip fractures alone contribute to the amount of injuries that happen. And as I mentioned, hip fracture is like one of the dangerous and worst things that can happen for older adults, because that can really put them in the back seat. The function completely declines if they're in that nursing home or in the hospital for a few weeks, and then there is that downhill to their health. In 2030, this is the prediction. So 2018, we have 52 million, 36 million falls, and 8 million injuries. And in 2030, they're predicting we'll have 73 million people. That's roughly about 1.5 times of what we had in 2018. And just imagine there is that surge in the number of older adult population, and now that's going to go up in terms of falls also by 1.5 times, which is 52 million falls. And that said, the prediction for injuries is 12 million, and now you can calculate how many hip fractures or traumatic brain injuries might occur by the year 2030. And this is, you're talking about like in the next 6 years. just imagine what this aging population is going to do in the next 10 years, in the next 25 and 50 years, because we see this tremendous increase in aging population in the next decade or two. And Medicare, Medicaid, I'm talking about the state of United States. Medicare and Medicaid is one of the popular commercial companies for aging adults, and they indicated that more than $50 billion in non-fatal falls have been spent as an expenditure in 2015, and $764 million for fatal injuries. So these are like very big, alarming numbers, and there's this big problem, and a country like United States is really struggling to see what kind of interventions can we have. How do we help these falls not happen? But there are very less solutions, or there are solutions, but it's not really reaching to this population.
The falls here, 52 million, you are 36 million, right? So this 52 million people, and this is some people with multiple falls, right?
Yes. Yes. So moving on, I would like to discuss about what are some of the risk factors as to why falls happen. So this is from the extensive background that I have with the rich experience of being a clinician as a physical therapist, and also as a researcher. I have sifted through the literature and reviewed five top fall risks. The first one is unhealthy aging. And this is one of the reasons why we physical therapists have a lot of referrals, because we get these doctors that refer to us, patient has muscle weakness and balance, please see them for physical therapy for the next 4 weeks, right? And why does this happen? So for example, I'll tell you an example, and this will really make sense. I saw last week 2 patients, 70-year-old and a 71-year-old, both of them pretty much the same age. But the one 71-year-old had a goal of walking up to 0.5 miles because he wants to take a walk with the grandchild. The other 70-year-old said he wants to be able to walk to the bathroom. So you see how much difference there is. The same age, but we are looking at different functional levels. So if you look at it, one is probably not aging so well. That's called the pathological or unhealthy aging, right? And the other one, aging okay, their goals are much different. So we all age differently, and we want to, make sure that, there is that muscle weakness, poor balance addressed by, so many interventions like physical activity, proper exercise, nutrition, etc. The second fall risk is polypharmacy. So a lot of these older adults have at least 5 or more medications. And when they have 5 or more medications, that's when this term polypharmacy applies, and there is at least 80% interaction of the drugs when there is that polypharmacy. And what does it mean when I say interaction of the drugs? So when these drugs interact, they can cause cognitive decline, dizziness, they can't judge properly because of the medications and the way they interact. And older adults, as a matter of fact, they have very less metabolism of these drugs, and the drugs' half-lives actually increase in their body because they're not able to excrete those drugs super quickly, just like an adult that's in 30s or 40s, because their systems are down, both the renal, cardiac, all the systems. So when that happens, the drugs remain in their body for a longer time, and these side effects occur. And these side effects actually show up much more for a longer time, even if they cease the medication. So what I'm trying to say is, because of the polypharmacy and the effects the drugs have, the adverse drug reactions, there is that second top fall risk that happens. And thirdly, they have complex medical conditions. So example, I saw one patient actually yesterday, heart failure, cancer, osteoarthritis, and many more. Now, they have poor tolerance to exercise because of their cancer and their heart failure condition. they can't walk as much, or they can't engage in exercise and standing because of the arthritis in their knees. Now what is happening, they have poor physical activity levels, their sedentary behaviors are more, so which again leads to that top one fall risk, which is unhealthy aging, leading to a fall risk. And thirdly, fourth, we have the environmental factors. So a lot of the older adults over 60 have challenges with sensation. They have poor vision, they have hearing loss, they have neuropathy in their feet, which is poor sensation in their feet. So all of these factors actually put them at higher risk for falls. And lastly, but not the least, loneliness and isolation, and this is very real. And most older adults, they are all by themselves most times, because, and this is my experience, I have seen like home health patients where I go see patients in their own homes, and they are either by themselves or with a friend sometimes, but their kids are gone, they're settled, they're just all by themselves, and they're wanting to talk to somebody, but there's not as much interaction happening, and they feel very depressed. And because of the depression, there are sedentary behaviors happening, and they're not as active. And this is one of the patients that I had in Atherton. As you all know, Atherton is one of the richest zip codes in the United States, right? And she was asking me after my physical therapy session, can you stay with me for another half hour? I was wondering, what do you mean? We are done with this session, do you want more therapy? And she goes, no, I don't want therapy. I want you to stay with me and talk to me, share some of your experiences, or talk to me, I need somebody to talk. And that just kind of was so sad to hear. And by giving this example, what I'm trying to say is, rich or poor, doesn't matter, we all are social beings. We need people to talk to, we want to share and express our feelings. And when that's not there, that leads to a fall risk, because of the sedentary behaviors. Again, it goes to that unhealthy aging, the top one risk causing the fall. So all of these are indirectly, directly related to each other that can contribute to falls. So we have some existing solutions out there in the market for all of these problems, but they are very tunnel focused, meaning at the most they focus on one finger or two fingers, but they're not focusing on all 5 fingers at the same time. And they're very reactive. And when I said reactive, I mean, so there's this example of life alert. So most of my patients have this thing on their neck. There's a button that they can press if they need some kind of an emergency, if they're in an emergency situation like a fall or a trip, or if they can't get up from the floor, they can call that 911 button. That's also on their wrist. And it happens after the fact that the fall happened, but what are they doing? Is there anything that actually prevents the falls? There's not a one solution that prevents falls. Next, the gap is they're not tailored for individuals. They're designed for groups. I'll give you another example. So there is this program called Silver Sneaker. Some of you may be aware of it. It's conducted in YMCAs and other government programs, where they deliver an exercise program for a lot of the older adults over 60. But it's not just for one person. It's just a general program that they're offering. I'm not discounting that it won't work, but it's not addressing each and everyone's problem. And also, they may be not as efficient, because there's the AI, ML, that came up last year. So maybe we can use much more technology. So the key takeaway is there's high inequity in technology application. If you see young kids, like babies, right? They have this device that they put on the foot to see, how they're positioned, if they're, in their, tummy, how they're breathing, etc., to ensure that they're doing good. But what do we have really for older adults? Like, do we have, any latest, greatest technology for tracking their health? Yes, and sometimes, actually most times, they have caregivers, but then it comes with an expense, and caregivers are not cheap. They're very expensive. From what I know, They're anywhere between $50 to $70 an hour. And just imagine somebody having to, hire a caregiver throughout the day and then throughout the night, it's going to be very expensive. But that's a great point.
Professor,
Yes.
question about age. You have a few examples and talk about the ages about 70. Do you see the force is getting younger or getting older? The force happening.
So there is this classification of older adults where 60 to, so let me just back up, 65 to 75, younger older adults. Middle-aged 75 to 85, middle-aged older adults, and old is 85 and up. Now there is that 3 age groups that we classified, right? As you get classified into the older group, your chances of falling is very high. Yeah. And because of the comorbidities or the multiple complex conditions that they have, their chances of falling increase tremendously. Okay, so here I want to address the 4 pillars for robust aging. So what I mean by this is, according to the age-friendly health systems, they designed this 4M approach, which is called the 4M framework, where we are addressing people's mobility, mind, medication, and what matters most to people, to give that evidence-based care, to give the best comprehensive care. And as you all know, and I'm so sorry to say this, but the US healthcare system is very fragmented and very plagued. There's lots of errors happening, and the reimbursement rates are so low for doctors. And nobody has time to sit and talk to patients about mobility. You have to be active for 30 minutes. No doctor actually, from what I know, 10 minutes, 15 minutes is a consultation with a primary care physician. And that's all the patients get. And if they're lucky, they get another 5 or 10 minutes if they have questions, but really, they don't have as much time to spend with each of their patients. So when that happens, there is that gap in the care that you can provide to these older adults. So by saying that, I want to say all these 4 M's give that comprehensive care, but when we don't have enough resources to do that, how do we do it? The very first M is mobility, where we want to talk to people saying they have to be active for at least 30 minutes. 30 minutes is the recommendation by ACSM, which is the American College of Sports Medicine. Any adult, including older adults, 30 minutes of physical activity, moderate intense exercise is the recommendation. And if they do not do that, their function declines, and as their function declines, their dependency increases and disease prevails. Second, it's the mind. So we want to ensure that they're not depressed, they're not having memory problems, mood problems, because when the mind is not clear or when the mind has problems, like with dementia, obviously their function goes down. See, we want to ensure that we're screening people for dementia, depression, and making sure that the medications that they're getting are not having these side effects of delirium, which is a temporary inattention, and the memory is kind of temporarily paused. So with medications, we want to make sure that that is not happening, and they're clear in their mind so they can have better function. Thirdly, we have this medication management, and I already talked about it in my previous slide. So polypharmacy, we have to ensure that they're getting their medications in the right dosage, and we also want to ensure that they're getting these age-friendly medications. A lot of these, drugs that we have, like the tricyclic antidepressants or benzodiazepines, opioids, these are the drugs that should not be given to these older adults. However, they get these because they have multiple complex conditions, and they're actually starting a de-prescribing movement to make sure that the older adults are not getting these medications if they're having them on, or even just reducing the dosage because the effects that they have is not worth taking them. They fall down super quickly once they start those medications, and it's just downhill from there on. And next, it's the what matters most. And this is something that I think comes first. And the reason why I didn't want to change the order is because the age-friendly health system defines that, and I want to keep that order. But to me, what matters most is the primary one that I would check with my patients. So when I first see my patients, I ask, what is that matters to you most? And the reason I put this question is out of experience. I had this one patient one time. She's 75, and I said, you have to stop, smoking. And she goes, why do you think I should stop smoking? And she goes, I said, well, if you want to be healthy, you want to quit smoking. And she goes, I'm healthy right now. I lived for 75 years, and I'm happy with the way I'm living now, and I don't need to quit smoking. So what matters most to that patient, probably smoking is something that's important for her. So I cannot just go and say you have to stop smoking, right? But what I'm trying to say, what matters most is you have to have all the other M's built around what matters most. For example, when a patient says they want to be able to play with their grandchildren, right? To play with the grandchildren, maybe you want to stand up, you want to squat. So my exercise or my goals would be in that mobility to give them those exercises that help them get stronger in their knees, stronger in their legs, because that's the goal that I want to achieve. Not that because I want them to be 30 minutes active, I just say, go for a walk for 30 minutes, and that doesn't make sense to the patient. So what matters most is what is the patient wanting, and you have to respect what their decisions are. And I put some snapshots of some of the literature that we have about the 4Ms, that's the age-friendly health system. And in the second slide, we have the multifactorial interventions that help with fall prevention, that is all of those 4Ms again, and how we should be assessing the risk and preventing falls in older adults. That's the last slide. Okay, so do anybody know what gait speed is? That's absolutely right. Yes, please.
Roger.
Okay, then you're dismissed. That's cheating, right? No, but go ahead, please.
You gotta walk 3 meters.
Yes.
As fast as you can straight.
Yeah.
And using the app.
Okay.
I think the speed
that
limit.
determines how, actually quite accurately, how long you're going to live.
Great, thank you.
That's right.
Yes. So I'm going to go over that, no problem. Good try.
I need a perfect gait. That's the most
dangerous. We're all going to find out when they
Oh, you know that.
Okay, so gait speed is one of the best metrics that has very clear evidence, and it's a very valid, sensitive, and specific measure that is easily interpretable, and we have very clear-cut points on what each number means, and it's the best outcome measure to predict falls and function in older adults. And it's very easily tested in clinics. It can be tested even with your own grandparents, parents, anybody that you may know, easy to administer. All you need is a 3-meter walking distance or 3-meter path, which probably would be like from here to that chair, right? And you just mark the distance, and then they have to walk from one end to the other end, that's the 3-meter distance. And then you would start your timer when the first foot crosses the tape, and then you would end when the lead foot crosses the tape on the other side. And you have the distance fixed, you have the timer that's recording the time. It's easy to calculate the speed. Speed is equal to distance by time. So you can easily calculate that. Now, with the walking speed, what are you really getting? So, like I mentioned, it is a strong predictor of when somebody is going to fall down, or it just tells you how healthy somebody is.
Does the person who walk is normal?
Yes, normal walking speed. You don't want to walk fast. Thank you. That's a good point. Normal walking pace. And there are some tests that we do with fast walking pace, but in this case, yes, it's normal walking pace. You just do it from end to end, see how long it took, and we calculate the speed. So if you actually plot, I'll show it to you in the next slide. If you plot the gait speed on the y-axis and you have the time on the x-axis, you can see how the gait speed changes over time. So you can go home and see if you have any older adults or anybody that you may know of. You can track how people are doing over time. You can check now and how they're doing maybe next year at the same time or in December this year, and see how the gait speed is changing, and then if they need rehabilitation. And some of the factors that predict the gait speed is strength, balance, cognition, etc. Where if they have poor strength, their gait speed is reduced. If they have poor balance, their gait speed is reduced. On the converse side, if you have, as you age, your gait speed reduces. Go ahead.
I don't know how popular it is, but there is this test that is sit to stand, where you don't use your hands, but you're in this, what do you call it, sitting stand, and you get up.
Good job, Kim.
Oh, you did that this morning? Yes. So if you can do it without touching your hand, right, it's supposed to be a sign of like your.
Actually, that's a very.
Your abs and your back.
Yeah. So that's a very valid test. I love the test. In fact, I use that almost pretty much every day. However, if somebody's strength is not enough, so basically, your name, sorry?
Greg.
Kim. Okay. So that.
That's not him. Greg.
That's not him, Greg. Okay. Sorry for the mix up in the names. You're Raj. Okay. So Greg.
Raj.
All right, keep going.
Gregory is right here, right?
Okay, got it. So that test that you mentioned, the 5 times sit to stand. So somebody would be sitting with their arms crossed, and they would be standing up and sitting down, standing up and sitting down. And we'll see how long it took for them to do 5 sit to stands, which is kind of like a standard measure. And if somebody took more than 12 seconds, that's an indicator of poor strength in the lower extremity and poor function. However, there are lots of folks that can't even do 1 stand-up. Then what do? You need a metric to see where they are in their starting point. So that's why gait speed, even if they're able to walk a little bit, even if they took like a few seconds more, you know where they're standing, and you can measure that as a baseline to see how their function is changing over time. And in fact, I wanted to do that test today with all of you, but then I thought it's a lot of liability on me if somebody falls sick.
We'll send a waiver.
Yeah, we'll send a waiver. Okay.
Volunteer.
So going to the next slide. So this next slide we have here, I'm sure you know where we are heading to next. So this is the solution that I'm trying to get at. So we plugged that 4Ms model and came up with this tangible measurement of those 4Ms, where this is the solution for the AgeWiser product. So I'm not going to keep you in more suspense. I'm just going to talk about it right away. So this is one of the solutions that we have in our AgeWiser app, where all the 4Ms are really standing out here, but really we want to see how we can measure each of those M's to see the progress or to see the change in an older adult's function. So in the first M, mobility, what we have done is we have created about 180 plus videos to improve their balance, strength, endurance, and flexibility. And all of these are done in our own garage. And actually, I did all the videos. I videotaped all of them with one of the child caregivers that's in our community that takes care of my kids. And we thought if we can rely her with the child care, we can rely her with the aging adult work. So I hired her, and we did videos on balance, strength, and endurance. And this literally is like how you say startups start with in your own garage, and that's what we did. All of the videotaped in our garage. And the second, we have mind games that we have included to improve somebody's cognition. And in the third bubble, we have the medication. And what we have in the medication is we have integrated a software in the app where when the person signs up for the AgeWiser app, they actually input their medications. And all of these medications, when they input, you can actually see if there is any interaction between the drugs. And if there is any interaction, if there is any conflicts, it detects the conflicts and notifies the doctor that's on the file, their primary care physician, or their family members who takes care of them, who has the healthcare power of attorney. And it really helps with alerting them, both the doctor, the loved ones, patients themselves, that something is not right. They have a conflict. For example, if somebody is taking acetaminophen and warfarin, both those drugs should not go together because there is a high risk of bleeding when that happens. And when the doctors do not communicate, or there's that lack of communication between patient visits, these drugs that interact and cause these side effects can be very deleterious to the older adult. So by having this tracking system, we are actually cutting that pathway to a fall, and we are alerting both the physician, the loved ones, patients themselves, so they're more careful to not have a fall. Lastly, we have the social matters. So what matters most, since that is hard to kind of make it tangible, so we made it more like a social connectedness piece here, where this is a virtual companionship that the patient can interact with. So it's a virtual caregiver where they're constantly talking to this avatar that they can set. It can be their son or their daughter, it can be Superman, it can be a Wonder Woman, whoever they want to really put that avatar. They can set it and have those meaningful conversations because it's the ChatGPT model that's in the back end. So they're having these meaningful conversations, it's connected. So for example, if I have the conversation with with my son as the avatar, and I say I'm talking to SEP students in Stanford about AgeWiser, it's going to ask, Mom, looks like everything is going great. Anything interesting? Are there any new venture capitalists that are interested in your app? Right? So very meaningful conversations happen. So the approach that we took for this app is really prevention, detection, and a closed loop. So what this prevention means is we are giving them exercises, we are giving them evidence-based program in that mobility M, where we are preventing those falls from happening in the first place because we are working on that balance and strength and all of those components that's needed for them to function well. And next we are detecting, predicting those falls, when those falls are going to happen. And we are doing a closed loop where we are communicating with the doctor, communicating with their loved ones. So all of those are happening, before a fall is happening. So there's that closed loop corrective action taking place. Okay, this slide is basically gait speed that I wanted to talk about. So on the y-axis, you have the gait speeds from 0.8 to 1.6, and on the x-axis we have the timeline. Say I measured somebody in January, their gait speed was between 1.4 to 1.6. That's in the green zone. And as you see, like till March, April, they were in that green zone, and then from April or March 17th, it started dropping down. And if you see that there is this star sign, right? There is that sudden drop in their gait speed, and there is that prediction happening that they're going to be in that high-risk fall category in the next few months. And that is what AI and ML is actually analyzing as we get all of those data points up to that blue line. And when there is that blue line ending, it's actually seeing a pattern that it's going to go down, and it's going to now make sure that the primary care physicians are being alerted to provide some timely interventions for function, to improve their function before a fatality happens. Because once it hits that below 1, somebody's function is really going down, and that's a high risk for fall category. And we have some clear-cut points I'd like to go over just really quick. So for somebody to walk safely in the street, when they go to the grocery store and come out of the store and they have to cross the street, right? They need to have at least 1 to 1.3 meters per second gait speed. And if they do not have that, then they're not considered independent, and they have to have those interventions. And somebody less than 1 meter per second, their cognitive decline is going to happen in the next 5 years, and this is very strongly indicated in the literature. This is one of the white papers that was published a few years ago, and it's very valid, standardized psychometric measure. And anybody's gait speed less than 0.2, they're extremely frail and bedridden, and they need a lot of intervention, and it also means that their mortality is coming soon. So the other hero feature that we have in our app is the vital sign monitoring. So I'll talk to you about the first image in a second. Let me go over the middle one first. So the vital signs can be just measured by using the phone camera. So if you put your phone camera in front of you and just look in that green circle, it's going to read the blood flow around your nose, around your mouth, and it's going to give those vitals. It's a non-contact it's a contactless way of measuring your vitals, and people actually love it. And I say this because I use with some of my patients, and they say this is great because a lot of them, when they're using the blood pressure cuff, it's very painful because the pressure is too much for them to handle, and they're often bruised on their hands, and they have very low muscle mass on their hands. And just imagine taking those blood pressure and monitoring those blood pressure twice or 3 times a day can be extremely painful to manage. So having something like this, I think it's going to be a boon for them. And by just looking at that phone camera, you're able to get the heart rate, the blood pressure, blood oxygen, and the respiratory rate. And heart rate is already FDA approved, and it's just plus or minus 3 beats per minute when you compare it to the manual method. And blood pressure is plus or minus 10 millimeters per Hg, and blood oxygen plus or minus 2.8%. So that's actually pretty close, and not that this will be like a medical diagnosis, but then the patients exactly know if they are close to that ballpark number of being in that abnormal range, so the doctors can take that corrective action soon. And then they also, along with the vital signs, we can also collect those wellness indicators like activity levels, their sleep, metabolism, their health, and how relaxed they are, their stress index, etc. And this very first image, it's actually a daily recommendation of their vital signs, of their gait speed. So every time when they open their app, it's going to say, check your vital measures, check your gait speed, and it's going to give those exercise recommendations, because now the app knows that where your function is when you sign up for the app, and when you put your information down, it's going to give you the exercises that are very relevant to the function of the person. And those are the mobility exercise recommendations for that day, and they also get those recommendations for brain games.
How does that work? Behind the scene, what happens?
So this works it's based on the RPPG, which is the remote photo plethysmography. That's the technology that's used. It's basically the light that's emitted and the light that's reflected in the blood vessels. So when the blood is flowing, it's the light that goes back and forth. That's what measures the vitals.
The camera on the phone is so accurate.
Yes. Yes.
So you're taking a video here?
Yeah, it's basically the person is, and you don't need internet for this. All they need is the camera, and then they just put the camera in front and
How many
looking.
seconds? For how many seconds?
40 to 60 seconds.
Oh.
So this is how the login page looks like, the interface, the user experience. You know, the third image is like how the 4 M's are really integrated into the app. You see there's mobility, brain games is the mind, medication is the pill management, and social matters is really that social connectedness piece, Jen, which is the virtual caregiver. And all others we have is like the social and the weather. We are still playing with them. We don't know what we're going to do, but they're there. In the vitals, they can actually check their vitals. And on the very top, if you see, there is that monitor for how much exercise they're doing, how many brain games they're doing, are they being active. It's basically like an activity tracker of each of the bubble. Are they keeping their activity levels good? Then the whole ring is closed, just like Apple rings. And then with the medication, they have these alerts coming up, like 2 p.m. You have acetaminophen to take, and then they hit yes. That shows that they took their medications on time without fail. So all of that is being tracked on that very top trackers.
Introducing AgeWiser.
So next I'm going to play in a summary, like what the app is like. Yes. Yes, we are actually working on producing it in Mandarin, Hindi, German. Yep. Okay. Yeah. So we are actively working on that.
So right now it's only English, right?
Right now it's in English. So I'm going to play a video of what the app does just in a few seconds. Okay?
Introducing AgeWiser, your trusted senior care app and AI caregiver. Created by a visionary leader in geriatric care, AgeWiser is designed to enhance seniors' lives through fall prevention. AgeWiser provides gait monitoring, personalized health recommendations, and daily insights to keep you on top of your well-being. Track your health and stay active with easy-to-use mobility tests and custom exercise videos tailored to improve balance, strength, range of motion, and posture. Focus on fall prevention, detection, and correction through artificial intelligence and machine learning applied to gait speed. Monitor your vitals with no-contact methods and receive real-time data. Our brain games for seniors help keep your mind sharp and engaged. Effortlessly manage your medications with our pill management system. Combat loneliness and enjoy meaningful interactions with Jen, your friendly AI companion for personalized chats and support. AgeWiser is a comprehensive senior care solution that ensures a safer, more independent, and more fulfilling senior living experience. Download AgeWiser today.
Hey, you're doing it now. Thank you so much. This is just a brief summary of what we discussed, what is in the app, the exercise piece, the brain games, medications, vital signs measurement using the camera, and then how we have the closed loop system. And to your point, Mandarin, Hindi in progress. We have about 1,187 downloads with a retention rate of 40%. And it's downloaded in about 33 countries. We already patented filed 2 patents. And we are in active talks with research studies with Stanford, University of Massachusetts, and the NFL alumni. And this is the first ever 4M digital tool to measure the function in older adults. And in this slide, I just want to show you what we are in the present situation. We have this Apple Watch that's monitoring our vitals and some of the health metrics. We have the Aura, we have Smart Socks, Dexcom, and some other stuff. And this is from Journal of Nature. And I wanted to share with you guys this slide because we are going to be in this future health tech in a few years where we'll be using all of those robots and probably when Elon Musk introduces that chip, we can enhance our cognition levels too. So I really thank you for your time today, and it's very late in the night, and I appreciate each one of you for being present and making this talk very lively. Thank you. So we have 4 multiple choice questions which may take less than a minute. If you could answer them, that would be wonderful. And
we thought we were supposed to ask questions. No, never mind.
You could ask questions.
Yeah, please ask questions too, please.
It's just like,
I'll pass it over to Raj now.
CFO, I'm just kidding. So right now we have Pro and Ultimate, about $49.99 per month. But we're still playing with the price. That is one of the questions. What is the WTP you're willing to pay?
Sure.
So that is one of the questions.
You designed the questionnaire after listening.
Yeah.
Having a relative who's also about 91, and so if you were able to get it so that Medicare or Medicaid are actually having it as an allowable expense, you have a better shot at willingness to pay, because a lot of folks are limited to $2,000 a month and what they get from the federal government, and that's all they get.
Absolutely.
Everything, housing, nursing care, all of this.
No, I completely get it, and that's our vision. My vision is to make this accessible to everybody that's over 65 through their Medicare, and I know it's not easy, but I know there is a path to it one day. Thank you.
So is the gait speed corrected for age and race and demographics?
Great question. I don't believe so. It's one standard metric, and whatever you have is for all ages.
I just wanted to comment on that. I think I applaud the whole thought that's going into the app. There is a silver tsunami that's going through all the countries. For my country, by 2030, we expect 1/3 of our population to be over 65, the young people. So I think there's a lot of use cases for this app. You could look into this app as an inpatient app to pick up potential falls in the inpatient setting, because there are many times where falls happen in the inpatient setting, and by the time the doctor finds out going to, there's also use cases in the home. I feel that rather than just being a preventive app, like what you mentioned just now, it can also be a reactive app. We know the mortality risk of hip fractures actually increases after 24 hours. It's up to 70% after 24 hours. So if your app is able to detect the fall of the patient, then you activate the emergency services, activate the doctor, and ensure timely care to the patient. That's another thing that you can look at. And I feel if we actually just some feedback. I think if we want to scale up the app further for the venture capitalists here at the Polypharmacy, we can look at this app as a whole ecosystem for the elderly. Elderly, other than looking at preventive exercise to make them to slow down their degeneration, there are also medications, there are also calcium vitamin D supplements that you can link up with maybe Costco or something to upsell these supplements to the elderly and remind them that these are essential things. Go into the sun for 1 hour and all that to get a daily dosage of vitamin D. I think these are other areas that we can look at. Also link up with pharmacy to look at pharmacy spec consolidation for their medications. Overall, I think there's a lot of potential for this app in many countries and in many use cases. So,
thank you so much for that feedback. I know that's a lot that you mentioned, but I'll try to remember each one of the points that you said. So to the very first point that you said is inpatient setting. This is developed for community dwelling, older adults, that's more in the high functioning. But also one of the thoughts that we had is we want to promote it to the nursing homes and the senior cares like assisted living facilities, where they have their own people that's administering all these exercises. It just has to be a different platform that we have to come up with, and that's a great point. And secondly, you said this is about the reactive step, right? We have a button, 911 button on the very first screen when they open the app. Hopefully they don't fall using this app, but if they do, they have the 911 button to call the paramedics. But we don't have anything that can identify. There's no sensors, because that will become a different product again when we add sensors, and it becomes very complex. So that's why we didn't go that route, but that's a great point.
We have a classmate there that does sensors.
Yeah, so,
Okay.
so just a quick one. I think I love this presentation. What you're doing exactly what I've been doing this for 7 years. We definitely can work together. I have all the sensors. I have this patent in 7 countries in the world.
Wow.
Where we actually detect the movement, we can predict the disease.
Mm-hmm.
And actually, currently we are in productions and deploying in Thailand to 12 elderly care centers.
Oh,
so actually, we'll integrate all the things that in the photo and the last photo were there already. We connect everything. We're actually working with doctors in terms of predicting the disease based on the movement, and actually medications and everything and the movement.
Nice.
And actually, we are finding pattern in the US as well.
You're a competitor, I'm not going to talk to you.
but I guess we could be a partner. I guess because we're trying to find somebody who can actually, first is they have to be passionate.
Yeah.
In every country that we go, Japan, German, Sweden, they have to be passionate. They have to be some people like you, not just like the businessman.
Right.
Because this is more like a social enterprise business. I'm not intend to make a lot of money out of it, just to make sure that the government can support in every country. I think that's my mission.
Yeah, definitely we'll get in touch with you
Yeah.
and we'll see how we can partner and collaborate. Thank you.
So 2 suggestions. Download the app. First of all, brilliant presentation. Very well laid out. I think the problem statement is very clear. Both my parents moved from India. They live with me here. This is a very real problem for me. First is, again, I think as someone who's I've come through a startup and we've scaled it significantly. You want to find your channels and give this product almost free for the channels. The channels are, like a physiotherapist comes to visit both my parents once a week, and she's watching them, the kind of stuff prescribed by the doctor. For the physiotherapist and all, this should be free of cost, right? So that they are starting to publish this and advertise this on your behalf. And then the second is the first month free for all the features, so that they experience it and they can buy into it, right? Initially, my thought process was, as you get older, will you do more on mobile? But the reality, when I thought about it, my mom spends 90% of her day on the phone. 90% of the day on WhatsApp.
You made my day, because one of the biggest questions that we had, that is, do people really can use this app because it's very tech savvy? But then, like you said, your mom uses 90%. My mom does too. But then when it comes to their health, they're like, no, I don't want to use technology.
Correct.
But I think it's the younger generations that need to, train them. Okay.
So I could see something else. You've got to be careful with the security, but you just say now, you may have a parent that's not actually using it, but they're talking to you, that you can see everything that's going on, and then you can supply that. There'd obviously have to be some security because anybody can check.
Right.
But that would give security. You'd actually find, so you said about Medicare, but and they're not going to be spending their money, but their children will be wanting to know that they're okay and will pay a premium on the phone or on the app. This is good.
Thank you for that feedback. We have custom dashboards that we are in process right now. We are making for the family members, for the physician, and it's all HIPAA compliant, so not anybody can just access. And that's a good point. Thank you. Yes.
I did talk to Raj about it, so you may have heard. I think the first thing that comes to mind is that older people don't see themselves as old. And your visuals and how you present the words, it needs to feel young, younger. They know who they are.
But not too young. So there was sorry to interject, but there was a face in there that I don't think older people will relate to at all. So from a marketing perspective, I want to think about
So,
the
so
faces.
for example, the app has grandma and grandpa, right? So,
Yeah.
and you know, because if you look at TV and you see 60-year-olds on TV look like 45-year-olds, you know, I mean, that's kind of
Yeah, that's how they
that
would portray
mindset
us.
of looking at that,
Mhm.
you know, I think is really important because it just makes older people feel bad to kind of, you know. And the second thing I think I mentioned is that if there's one killer problem solver, something, maybe it's something that people want to use and it just works really well. And you know, it's not like an application of a lot of different things, but it really cuts through and solves that one problem. And I think would be really good. There's also a guy here who's from Singapore, and he's the head of Singapore Ministry of Health.
That's
Colin. And you know, I'm from Singapore, so I have the app, and you know that Ministry of Health, they have, I believe, huge amounts of information. Singapore has, I think, one of the healthiest age groups, like least pain, you know, in age, and so on. So it's just kind of, I'm extremely proud of like being in Singapore where everything is in this one app. I mean, like literally all my COVID documents, but all my shots, like, and a lot of people are older, and it gives you all these kind of things that you make suggestions. I think there's some of that's already in there. I think if you talk to them, you could learn a lot about what would really work, because he's kind of buyer of technology. You know, he aggregates all these. Singapore government is the #1 tech company in Singapore. So
I would start though with product market fit. I mean, it depends on which market you're going after, right? They're very different. I think there's some idiosyncratic aspects of how you match that up with the problem you're trying to solve. It's very demographic. So it just depends on, you know.
But all I'm saying is that there's a lot of what do you call it, knowledge built in, because they're you know, and like I said, it's already an age group. They've already have accumulation of what has worked and what hasn't. So maybe I didn't make it really clear, but you know, I think he'd be a really good person to talk to.
Okay, yeah, sure. Probably Raj can introduce me to him. Yeah. Yes.
Yeah, I like a lot the application. I think it's amazing because it works like in a social way. I'm thinking. I have been speaking with Raj. I have been thinking of the business model, because how you will be monetized. How do you monetize this? So for me, it would be interesting that you have a lot of experience in that. So we'll be in touch with the doctors that works with elderly people. So I think that should be the promoters of this application. Because, for example, in Argentina, my sister, she's a doctor, and some labs, they promote their medication sponsored by the doctor. So for me, it would be a good idea if you can get, like, the doctor says, for example, that to avoid a fall, for example, or the cause of the fall will be like you get injured, and also you should take medication. So this app is better than get injured and better than get medication, and the price is less than, I don't know, $5.
Right.
So I will be by that side, but for me it's amazing, and I think there is a market for this. But you should be really wise to AgeWiser. You really wise to get that channel, because there's the one that will help you promote the application.
So you're saying promote it to the doctors?
Yes, for me, and also I will add to the app like a channel with the doctor. Okay. So you will have like the opportunity to be in touch with your patient, because my grandmother, for example, she was like that problem you mentioned, the one with the medication. because the doctor they give a lot of medication that was like conflicting. So she was like her problems. So I think that if you have that alarm, it will be great also for the family. But I think the doctor is bored in their business. So I would think.
Thank you.
Just as an experience, share a lot in terms of, I think we're not working on B2C because one thing that is pretty critical from the data privacy perspective, we're working with only government, and actually only government, and we actually get a very restricted data access. You know, even all the devices has to be encrypted with our proprietary encryption. Because if this data is actually out to the surgeon hand, we will pass it. So it's actually, and you know, the entry barrier as a startup, as a VC as well, an investor and a VC as well. So you probably need to think about what is the entry barrier. Because looks like the entry barrier is the video. Actually, and something which is like using video to detect, actually I know the API. But actually, if you go to talk to the doctors, they will say no. It's not usable. Maybe the heart rate is okay, but actually in terms of SpO2 and everything, it will go.
So that's why it's not FDA approved yet,
yes.
You know. So we are still working on refining the machine learning algorithm, etc. And you know, US has really strong data standards, and we're working on type 2 SOC 2, which is the gold standard, right? You know, so so all of that is in progress.
Yeah, I will be interested because that thing is actually I saw that a couple of years ago in terms of detects everything, the heart rate and the blood pressure. I went to see the doctor and I said, no way you're gonna use it.
Is it just one doctor or?
A large hospital in Thailand, like professor.
Do you think it's different?
It's actually probably scientific approval, but actually you are not fighting with the scientific. You're fighting with the ego, egoistic of the doctor. So be prepared.
Okay. Thank you.
So I think I have two suggestions for the product feature because my parents are elderly according to your definition, and my mother took care of my father. And two top things she's doing every day in the past 10 years. One is the time of the medication, and the second is make my father move. Yeah, we're trying to make my father dance or any kind of exactly stretching or just like a kid. My mother said he's like she's like raising a kid.
Raising a child,
raising a child. So we always say that your father is a child, and just so two top feature from the elderly.
And you have both of them.
I have both
medications.
Of them. I have caretaker and the elderly, and I myself also I have a lab in Hong Kong doing anti-aging, and we can be business partners.
Absolutely. Let's talk.
Another thing that I want to give you something back because my parents are still in China. In China, there is a lot of aged people. They live in a center, big center. So your information, your app will be very good for them. But if you can have once a month to have an in-person to meet, that will give a lot of people to join your.
Yeah, I think as we grow as a company and we promote it to other countries and have it translated in other languages,